The acronym of the OPTILINK study is composed of the term OPTIVOL, which is a system which can measure the intrathoracic volume and intrathoracic impedance, so the water content. And this is linked, therefore OPTILINK, to a care alert system which directly transferred threshold crossing, so volume overload, to the Office of Physicians. The OPTILINK trial addressed a very relevant clinical question, and that is whether the early detection of intrathoracic volume overload, which might occur before signs and symptoms are occurring in heart failure patient, and sending this to the offices of doctors, which can take then the appropriate action, improves total deaths and cardiovascular hospitalizations. The objective of the study and the background is that overload and obviously also drops in impedance in the thorax can indeed occur before symptoms occurring, days and hours before patients go into pulmonary edema. So patients were selected to had severe heart failure, and patients had an implanted device like an ICD or a CRTD system according to the guidelines of 2008 when the study was starting. These patients were linked to the device, and this device measured the threshold crossing of the intrathoracic volume, and these signals were sent to the offices of the physicians. And the physicians then reacted to this system according to a very specific algorithm. So the patients who had these crossings were immediately contacted within few days or within the next day, and then the patients reported what was going on, and then the physician gave advice to the patient or even put him to the hospital. And if he is not in the hospital, the patients had to transfer his data for the next days until it is normal, or if it's not normal, the physician again took action according to this algorithm. With this technique, there were 80% of the threshold crossing, which can be seen in the device interrogations, were indeed transferred to the physicians. And these 80% led to an action of the physicians in a little bit more than 50% or in 70%, but however, in several instances there was no reaction. And these signals were followed in 50% by changes of drug treatment, or even of changes in 90% of the cases of diuretic treatment. So having done this, and with this adherence of the patients to the system, so 20% non-adherence, and with this adherence and algorithm where how the physicians responded, there was no significant change in cardiovascular death or total death or cardiovascular hospitalization. So this study failed with this specific technique to improve cardiovascular outcomes. The key figures are that with this algorithm, which involves the patients because he had to be plugged into his telephone, and the physician, which has to has to react to the signals, there is some potential problems, because patients were not hooked to the system like they were in the hospital or on vacation, or simply not hooked in. And with this device strategy or treatment strategy, there was no change of total death of cardiovascular hospitalization. The OPTIVOL study has shown that using an OPTIVOL device, which has to link the patient, or where the patient has himself to link to a socket and transfer data to the physicians, and then the physician is reacting by phone, does not change cardiovascular death or cardiovascular hospitalizations, and therefore the strategy needs to be refined.